Hello everyone, this is Dr. Prashanth and welcome back to Public Health series. In this video, I'll be briefly explaining the primary healthcare. The primary healthcare approach has its inception in the year 1978 during the Alma-Ata Conference. The declaration was endorsed at the Alma-Ata Conference, jointly convened by WHO and UNICEF, that focused world attention on primary healthcare as the key to achieve an acceptable level of health. Primary healthcare and health for all are part of the Alma-Ata Declaration that marks the commitment of UN member countries towards achieving a more equitable health status across the world, particularly in developing countries. Now, coming to the definition of primary healthcare, it is an essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology, made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. It is the first level of contact of individuals, the family and community with national health system, bringing healthcare as close as possible to where people live and work and constitutes the first element of a continuing healthcare process. There are three intertwined aspects of primary healthcare: package or a set of activities, level of care, and the primary healthcare approach. To start with the package or set of activities, the content of the package evolves with changes in the pattern of health problems. For example, in 1978, they agreed to have a package which consists of at least 8 elements, in which preventive and promotive measures were emphasized without neglecting curative and rehabilitative measures. This helped to achieve balance between public health and medical care. Now, coming to the elements of primary health care: education on prevailing health problems and methods for preventing and controlling them, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health care including family planning, immunization against major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries. The last one is the provision of essential drugs. Now, coming to the second aspect, that is level of care, as already said, the primary health care emphasizes the primary level of care, that is the first level of contact with the health services. This doesn't mean that the higher levels of care are not important. They are mandatory to provide the necessary backup services and support to supervision to achieve a continuum of quality and safe care. Now, coming to the third aspect, PHC approach, or we can call them as PHC principles, pillars, or strategies. This aspect of PHC explains how the primary healthcare concept materialized in practice. Now, coming to the primary healthcare approach or principles, to start with equitable distribution, health services must be shared equally by all people, irrespective of their ability to pay, and all must have access to health services. Second is the community participation. The community involvement is an essential ingredient in the primary healthcare, where the involvement of the community in planning, implementing, and maintenance of health services, besides maximum reliance on local resources such as manpower, money, and materials. Third is the intersectoral collaboration. Goals of primary healthcare cannot be achieved alone by the health sector. So, primary healthcare should be set in the context of integrated development to include health, housing, transport, water and sanitation, nutrition, agriculture, education, and community development, including women's development. And now, coming to the appropriate technology, it is defined as scientifically sound, adaptable to local needs, and acceptable to those who apply it and for those whom it is used, and that can be maintained by the people themselves, keeping with the principles of self-reliance with the resources the community and the country can afford. Now, coming to the prevention of disease and health promotion, preventive aspect of healthcare decrease the burden of disease and also decrease the cost of healthcare. Through health promotion, individuals and families build an understanding of the determinants of health and develop skills to improve and maintain their health and well-being. Thank you.